Living with diabetes involves managing what you eat, how much you exercise, and often what supplements you take. While many antioxidants are celebrated for their health benefits, particularly in reducing oxidative stress and improving insulin sensitivity, not all antioxidants are recommended for people with diabetes. In fact, certain antioxidants might interact with diabetes medications, exacerbate certain conditions, or prove less effective than believed. This article dives into the top 5 antioxidants that might not be the best choices for those managing diabetes, backed by scientific research and expert advice. But before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button and hit subscribe. Thank you, and let's begin. Starting with beta-carotene, an antioxidant found in carrots, sweet potatoes, and other orange-hued vegetables. While beta-carotene is generally safe and healthy, studies have shown that, in supplement form, it can be problematic for certain individuals, especially smokers and those who have been exposed to asbestos. For people with diabetes, the concern is that high doses of beta-carotene supplements might increase the risk of lung cancer in these groups. A large study published in the Journal of the National Cancer Institute found that high doses of beta-carotene supplements were associated with an increased risk of lung cancer and heart disease in smokers and workers exposed to asbestos. For diabetics who smoke or have a history of significant asbestos exposure, taking beta-carotene supplements could pose additional risks. Moving on to vitamin E. It's known for its role in skin health and protecting against heart disease. However, high doses of vitamin E can potentially lead to an increased risk of heart failure in individuals with existing heart conditions or those who are at high risk of heart problems. A study in the Journal of the American Medical Association indicated that high-dose vitamin E supplements, above 400 IU per day, might increase the risk of heart failure in people with diabetes who also have a diagnosed heart disease or are at high risk of such diseases. Thus, while moderate supplementation might help with antioxidant defense, excessive intake can lead to complications, particularly in diabetic patients with cardiovascular issues. Niacin, or vitamin B3, while not a traditional antioxidant, is often included in discussions about metabolic health due to its effects on cholesterol levels. Although niacin can help reduce bad cholesterol and increase good cholesterol, it might also increase blood sugar levels, which is a significant concern for those with diabetes. Research published in the New England Journal of Medicine has shown that niacin therapy in individuals with diabetes led to a small but significant increase in blood glucose levels, which might require adjustments in diabetes medications and diet. Iron supplements, although not antioxidants per se, often come up in discussions about supplements to avoid in diabetes management due to their potential to increase oxidative stress. Excess iron in the body can catalyze the production of harmful free radicals, leading to increased oxidative stress and potential damage to cells and tissues. For diabetics, this can mean worsening of diabetic complications. A study from the Journal of Clinical Endocrinology and Metabolism noted that high iron stores were associated with an increased risk of developing type 2 diabetes, suggesting that unless a person has a diagnosed deficiency, adding iron supplements might not be a good idea. Lastly, selenium, an essential trace mineral that acts as an antioxidant, is required in very small amounts to support effective immune function and hormone synthesis. However, similar to iron, too much selenium can lead to negative effects, including increased risk of diabetes. A study published in Nutritional Biochemistry found that, while selenium is crucial, excessive intake can lead to insulin resistance and increased risk of type 2 diabetes, especially in individuals who are already selenium sufficient or receiving enough from their diet. Before reaching a conclusion on the role of antioxidants in the diet of someone with diabetes, it's important to delve into the mechanisms through which supplements may interact with diabetes medications and how they affect the body's metabolic processes. Antioxidants, by their very nature, serve to protect the body from oxidative stress, which is a significant contributor to the deterioration of cellular structures and function, particularly in chronic conditions like diabetes. Oxidative stress is linked with a range of diabetic complications, including neuropathy, retinopathy, and an increased risk of cardiovascular disease. Thus, the rationale behind supplementing antioxidants is often based on their potential to mitigate these risks by neutralizing free radicals and, potentially, improving endothelial function and insulin sensitivity. However, this well-intentioned approach can sometimes backfire if not managed correctly. For example, some antioxidants in high doses, such as vitamin E and beta-carotene, have been shown to have pro-oxidant effects, which can exacerbate oxidative stress rather than alleviate it. This paradoxical outcome suggests that the dose and form of antioxidant supplementation need to be carefully considered. Furthermore, interactions between antioxidants and standard diabetes medications can alter the efficacy of these drugs. For instance, high doses of vitamin C can interfere with the effectiveness of certain statins and antihypertensive medications, which are commonly prescribed to manage diabetes-related conditions. Additionally, certain antioxidants like niacin can raise blood sugar levels, which may necessitate adjustments in the treatment regimen to counteract this effect. Beyond the biochemical interactions, there is also the consideration of lifestyle factors that significantly influence the impact of antioxidants on diabetes. The overall dietary pattern, physical activity level, and even the presence of other health conditions can determine the effectiveness of antioxidants in managing diabetes. For example, the antioxidant lycopene might be less effective in a person who smokes or has uncontrolled hypertension, whereas it could provide substantial benefits in reducing the risk of prostate cancer and heart disease in others. Thus, when considering antioxidant supplementation, it is crucial to look at the broader picture of an individual's health. Evaluating the full spectrum of a person's condition and lifestyle allows for a nuanced approach to supplementation, one that supports the individual's specific health needs without counteracting the management of their diabetes. This careful consideration is particularly critical given the complex nature of diabetes, which affects various metabolic pathways and organ systems. Engaging in an informed discussion with healthcare providers about the potential benefits and risks of antioxidants, as well as ongoing monitoring of health outcomes, is essential. This strategic approach ensures that each person with diabetes can use supplements not just safely, but also effectively as part of a comprehensive plan to manage their condition and improve their quality of life. In conclusion, while antioxidants are generally beneficial, those with diabetes should approach supplementation with caution. It's essential to consult healthcare providers before starting any new supplement, especially those that can influence blood sugar levels or interact with diabetic conditions. By being mindful of these considerations, individuals with diabetes can avoid potential risks and focus on antioxidants and supplements that are safe and beneficial for their specific health needs. This personalized approach to diabetes management ensures that each person can achieve the best possible health outcomes without unnecessary complications.